Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Will Kwasigroh, and joining me in the studio today is Ms. Jennifer Varner. She is the Director of Clinical Quality for West Tennessee Healthcare. Jennifer, how's it going? How are you?
I'm fine.
Good. Thanks for coming in today. So today we're going to be talking about accreditation. That's basically a big word for we are who we say we are. We've earned these awards, and Jennifer's here to talk about that today. But before we do, I want to get to know you a little bit better. So tell me about yourself, where you went to school, what you like to do when you're not at work, family, insert anything here.
All right. I was actually born and raised in Memphis, went to Bartlett High School. Any Bartlett fans out there?
I have a buddy who went to Bartlett, actually.
Really?
Mm-hmm.
And went off to college in Arkansas. Most of my nursing career has been actually in critical care. I loved critical care. And the last few years that I've been back in Jackson, I've been STEMI coordinator and worked with our chest pain registries, our cardiology registries, and our chest pain center accreditation up until just the last few months when I became director of clinical quality.
Awesome. Well, again, congrats on the new position. That's great. So what does it mean to be accredited or certified?
Any accreditation or certification is actually beneficial for hospitals. It provides them with practical resources, any support. It helps minimize if there's gaps in processes or treatments. It helps reduce those, and it's a great way to improve processes and implement guideline-driven medical therapies, best practices, or what we like to say in the medical world, evidence-based care. So it helps, any accreditation or certification helps improve that care that we're providing to our patients.
Gotcha. So how long does it take for a hospital to become accredited? And I'm sure there's different accreditations you can get. I'm sure each one has different timelines.
Yes, most of the ones that we've done at Jackson General have taken about a year.
Okay.
Except for the last one we'll talk about.
Okay, cool. What is the foundation for achieving these accreditations?
So basically, the foundation is working with the professional organizations such as American College of Cardiologists. We have Society of Thoracic Surgeons, and each of these organizations have what we call registries that we work with, that we show the care that we're providing to our patients, and that gets critiqued or looked at to see how well we are providing the care for our patients.
So we are recording this podcast on February 11th. Most people know that February is Heart Month, so the main reason why Jennifer is here today is to talk about the West Tennessee Healthcare Heart and Vascular Center. So can you tell us what accreditations or certification that the Heart and Vascular Center has achieved in the last couple of years?
Yes, I would be glad to. We have consistently achieved the Chest Pain Center accreditation with PCI over the last several years through the American College of Cardiology. We have also achieved for the last few years the STS, which is Society of Thoracic Surgeons. We are a 3-star facility through them, which is the highest you can achieve.
I think we had some sort of a press release that went out about that.
Yes.
Maybe about a year ago, so?
Yes, sounds about right.
Awesome.
And we recently, I think a couple of years ago, we became the first hospital in Tennessee to achieve the TAVR certification, which means that we are providing the most up-to-date technology when caring for patients that are getting a transcatheter valve replacement.
I did a podcast with Scott Sweat.
Yes, he is our TAVR coordinator.
Yes.
He does an excellent job.
Yeah, his podcast was great. I learned a ton about the TAVR and, you know, the valve that goes in and then starts pumping. It was really fascinating to learn that. That's really cool.
Yes, he is very involved with that. And we have also had for several years, our Echo Lab has been accredited. And again, that just means we're providing the best care, the best technology when we are providing echoes, that service for our community.
Yeah. Let's talk about heart care.
So our latest and most exciting and most, I guess, prestigious award, our certification that we've had here at Jackson General, is the Heart Care Center Award, which is a national distinction of excellence. It's the ultimate reward for quality patient care that a hospital can receive. It is actually a collective award. It actually consists of all of our other registries and awards and things that we've put into place over the last several, like 10 years. We've been working towards this, and it is designed to shine a light on the elite group of U.S. hospitals that are actually going above and beyond to ensure that all our patients that come through our door have the highest quality cardiovascular care. It's one of the highest recognitions that is given from the American College of Cardiology. So we're very excited to receive that award. We were, again, one of the first hospitals in Tennessee to receive that award. Mm-hmm. And there are not very many throughout the nation that actually have that award currently.
I said on a podcast earlier this week that seems like, especially the Heart and Vascular Center, are running with the big dogs, if not leading the pack. So I think that kind of hits the nail on the head there again.
Yes, I think people don't always realize you do not have to leave West Tennessee to get high quality, consistent, up-to-date technology, cardiac care. We have it right here at Jackson.
There's no reason to go to Nashville or Memphis when you can maybe even get better care here in your backyard.
Right.
So that's awesome. So last but not least, why is it important for our patients to know all this? Or in layman's terms, why should people really care?
So what this means for our community of West Tennessee, really for any cardiac care, any of our hospitals or affiliates, wherever you go, you will be getting the highest quality care. It will be consistent care. We have 3 of our facilities right now that haven't had chest pain center accreditation in the past, or hope to have that by the end of this year, which means all of our hospitals will be chest pain center accredited. Amazing. So if you're having chest pain and you go to Milan, you're going to get the same care that you would get if you come to Jackson. Mm-hmm. So it means our care will be standardized throughout the region, and again, wherever you walk in, you should be provided the same care.
Absolutely. Being a healthcare system of 7,000 employees over a vast area of the state, it takes a little while to get the same quality of care in all those places. So it's really exciting to see that on the horizon,
right? Especially
for heart care. That's amazing.
Yes, just a matter of getting everyone on the same page, right. Everything standardized. So it honestly doesn't matter where you go. Now, obviously, we have more of the procedural type. So if your heart or your chest pain symptoms require services here at Jackson, then we would definitely get you here fast.
Absolutely.
But it wouldn't matter which facility you presented to. Yeah. So I think just to kind of sum it up, having these certifications or accreditations actually keep us on the cutting edge. It makes sure that we are providing consistent care to every patient that walks in the door and giving them the best care that we know about right now through whatever professional medical organization that is. So we are continuing to work on that in other areas. Today we just talked about heart because it's Heart Month, but we have several of our other specialties that are doing similar things.
Yeah, and that's amazing. And I'm fortunate and lucky enough to work in a system that's the standard. I think it's amazing.
Yes. Thank you.
Absolutely. Well, Jennifer, thanks so much for coming in today and talking about all the accreditations and the Heart and Vascular Center. No one wants to receive health care. It's good to know that this high quality is literally in our backyard. So that's amazing, and I thank you for coming in and talking about it.
Yes, thank you.
You're very welcome, and thanks for listening to another episode of We Talk Health.